Your surgeon can perform a technically flawless repair, but if your body isn't ready to heal, that repair can fail. Almost nobody is talking about what ready to heal actually means. I'm Jess, a functional medicine specialist and a registered nutritionist. What I'm about to take you through is what determines how well your body recovers after surgery. The biology, the pre-op preparation, and the post-op protocols we use in clinic to support the strongest possible recovery. Now, my client Tom is 41, tore his rotator cuff playing tennis, had surgery followed by the standard pathway. At 14 weeks, his repair had partially failed. His surgeon was excellent, the technique was sound, but when he came to see us before his second surgery, we ran bloods. His vitamin D was deficient, his protein intake was nowhere near what healing tissue requires. Sleeping 5 hours a night, his inflammatory markers were elevated, his body wasn't in a position to heal, and nobody checked it. Now, tendons are made almost entirely of type 1 collagen. They have a limited blood supply compared to muscle, which means fewer nutrients reach the repair site and healing is slow. Now, repair happens in 3 overlapping phases. Inflammation, where your body clears damaged tissue. Proliferation, where fibroblasts lay down new collagen, dependent on amino acids, vitamin C, and zinc. And remodeling, where that collagen gets reorganized over months into something structurally sound. If your body can't run these phases properly, the repair stays weak. So why is nobody checking whether your body is equipped to do it? Now, patients who are nutritionally optimized before surgery have better outcomes. A Stanford trial in 2025 found that personalized prehabilitation cut moderate to severe complications from 11 out of 27 to 4 out of 27. With Tom, we had 6 weeks. So protein first. His intake was 60 grams a day. He needed closer to 120. We restructured his meals and added collagen peptides. Vitamin D was deficient, so we corrected that over 4 weeks. We started a multivitamin covering B vitamins and zinc picolinate for tissue regeneration, balanced with copper to protect collagen cross-linking. We shifted his plate towards nutrient-dense whole foods, increased oily fish, and cut refined sugar. Now, there's a timing element that catches people out. Omega-3s need to stop 7 days before surgery because of blood thinning effects. Most other supplements 3 days before. Then restarted post-op subject to your consultant's approval. Getting this wrong creates real problems. Getting it right is something a functional medicine practitioner manages for you that nobody else in the pathway is thinking about. If you go into surgery already chronically stressed, your cortisol doesn't come back down after the procedure. Now, sustained cortisol suppresses immune function, interferes with collagen synthesis, and directly slows wound healing. Caregivers under chronic stress took 24% longer to heal a standardized wound than matched controls. So growth hormone, one of the primary drivers of tissue repair, is released during deep sleep. Poor sleep suppresses it and elevates cortisol further. We're aiming for 8 to 9 hours as a clinical priority, not a nice to have. With Tom, we addressed caffeine timing, built a wind down protocol, and supported his nervous system with magnesium and adaptogenic herbs. By surgery, he was sleeping 7.5 hours consistently. That mattered more than any single supplement. Now, post-surgery, your body is in hypermetabolism. Protein requirements go up, micronutrient depletion accelerates. This is when most people eat the worst. If mobility is limited, protein shakes are genuinely practical. Now, collagen peptides with vitamin C are critical. A Tulane University orthopedic department found measurable increases in tendon thickness with collagen supplementation. Take 10 to 15 grams of hydrolyzed collagen with vitamin C 30 to 60 minutes before physio to maximize collagen synthesis. Vitamin C isn't optional, it's the required cofactor, and surgery depletes it rapidly. CoQ10 at 100 to 200 milligrams daily helps manage oxidative load from surgical trauma. Bromelain on an empty stomach reduces inflammation and clears protein debris at the repair site. Omega-3s support inflammation resolution once your surgical team gives the green light. If you've had a general anesthetic, supporting liver clearance with milk thistle is worth discussing with your practitioner. If antibiotics were used, a good quality probiotic protects your gut from the disruption. And vitamin B6 for post-surgical swelling. Most people don't know about this one, but swelling that normally takes weeks to resolve can reduce substantially within 24 to 48 hours with targeted B6. Now, Tom is 10 months post-op. Repair is intact. He's playing tennis again. The difference wasn't luck or a different surgeon. It was preparation. Your surgeon does the repair. Your physio does the rehab. A functional medicine practitioner does the biology. At Tailor Well, our team runs a pre-surgery optimization assessment covering everything we've talked about today, designed to sit alongside your surgical team. We'd always encourage you to share any plan with your consultant. If this changed how you think about recovery, share it with someone facing surgery. I'll see you in the next one.